we're the experts on birth and the process, but your husband is the expert on you.
Home births, hospital births, birth center births. Doulas can help all kinds of births.
Did you know that having a doula can decrease your chance of a C-section? Hi, I'm Susan White, and let's continue with our interview with the Doula Sisters, Emma Ray and Elizabeth Strysko, to find out the advantages of having a doula. Now, is there any medical evidence to support the different interventions that you use to support moms in labor? I know I was reading some articles the other day, and it looks like if you have a doula with you, there's a lot of benefits. So I know there was like a decreased C-section rate and a higher breastfeeding rate.
So there's like a 39%. I think it's on our Instagram too. We go into that a little bit more in detail of a decreased risk in C-section. I think 15% of like a spontaneous birth, not having to be induced, birth just happens. And then 10% decrease of use of pain medication. If you're, wanting to not have pain medication. Doulas are a great way to help calm anxiety, to help, especially in the beginning. We talk with clients a lot about their fears in labor and what some of their fears they may have before going into labor. And I think talking that out with someone that understands labor, who has been through labor, or who have not. Some doulas have not had labor before, but someone that you can communicate those to helps a lot with just your fears and anxiety of labor. Decrease in physical pain, coping, all these coping mechanisms that we help remind you and husband during it helps a lot in coping during labor. In active labor when that happens.
So sometimes if husbands get overwhelmed and don't know what to do next, that's when the doula can kind of step in and support both of them, right?
Yeah. Sometimes when you are in labor, you're like focusing on the contractions and sometimes you can prepare, and it's good to prepare, but sometimes having someone there to be like, let's try this. Let's move you a different way. Let's keep moving. Let's sit on the toilet backwards. Just having someone there to remind you of certain things that you can do to help in labor is really beneficial.
Yeah, and I was reading some of the articles that doulas can even help situations like teenage moms that maybe need more support. They've had good outcomes with that. And in some of the research studies, even decreased their premature delivery rates.
I think everyone should have a doula, it's great. I've had doulas. Emma was my doula for my last birth, and first time or fifth time, it doesn't matter. I think it's a great add-on to your team of your labor team.
How do you work with like the labor and delivery nurse, for example?
Yeah, I think part of it is when we step into the labor room, like we want to establish ourselves as as a doula, introduce ourselves. We're, on mom and dad's birth team, but also just establish the fact that we're like here to all work together and we all have the same goals in mind for mom and baby, and, just really being a team player in that way. And there's different things that we can do to like help the nurses if they need something. Like we can grab things like wet washcloths, but they don't need to be running around doing all these things. Like sometimes we can step in and do extra things, help mom with her comfort while the nurse is really focused on her care and reading the monitor. And, I think it kind of creates this really nice balance of like everyone has a role for mom. The husband, I think a lot of times moms will worry, if I hire a doula, is that stepping on the toes of my husband, who I want him to be my support person? And about that, we always say like, we are the ones who are like, we're the experts on birth and the process, but your husband is the expert on you. So like they know, they understand your emotions and everything that you're going through. They know how to calm you down. Well, we're the ones who say, like Elizabeth was saying, let's get into this position. Let's use this tool now. But your husband is there. He's the one like helping that oxytocin continue to flow because you feel safe and comfortable with him. So we never take away from that role. And if anything, we're always just trying to also empower your husband to know how to support you best.
So it really does sound like a team effort with everyone working together.
Yes. Yes.
So it sounds like that you've given birth in a lot of different experiences and helped a lot of other moms. So would a doula just be for someone that wants to be unmedicated, like have a natural childbirth, or just someone that's having a home birth, or do you help moms that have other childbirth goals too?
Yeah,
Yeah.
doula
Can be
all
for
kinds of births. Yeah, I think sometimes the misconception is like doulas are only for women that want to have a natural, no epidural, no pain medication birth, but that's not the case. Like I was induced. We help women that want to have epidurals. We know what position they need to be in. We help move them if they get epidurals, C-sections, VBACs, home births, hospital births, birth center births. Doulas can help all kinds of births.
What do you think? Does a doula need her own doula? Find out in part 3 of our interview.